A
Ishika,
very warm good
Ishika,
evening, ma'am.
are
Yes,
you?
ma'am.
Am I audible?
Yes, ma'am, you're audible.
Yeah, I think there is some network issue with my video. It seems.
Okay, ma'am.
No, I will try with this audio as of now.
Okay, ma'am. Good evening, everyone. A very warm welcome to all of you on behalf of the Indian Pharmaceutical Association, Delhi State Branch IPA-DSB, and Indian Pharmaceutical Association Students Forum, Delhi State Chapter IPA-DSF, SFDSC. I'm Ishka Gupta, Council Member of IPA Student Forum, Delhi State Chapter, and I will be your host today for today's session under our Know Your Profession KYP webinar series. This KYP series is designed to help pharmacy students and young professionals explore the expanding scope by the interacting experience of academicians and industry experts. Each session encourages us to reflect on one key question: what does the future hold for the pharmacist? Now, I would like to give the introduction to the theme. On the occasion of National Pharmacist Day, we celebrate not only the profession, but is also the evolution beyond traditional dispensing roles. Today, pharmacists are contributing across the clinical practice, pharmacovigilance, academia, industrial leadership, regulatory affairs, public health, and innovation-driven roles. The role of pharmacists is rapidly transforming within today's healthcare ecosystem. Our session today, Pharmacists of Tomorrow, Beyond Dispensing, aims to broaden perspectives, highlight emerging career pathways, and help students align their academic learning with real-world professional opportunities. Today, I would like to introduce you to the Dr. Saurabh Arora, President, IP, Delhi State Branch. We are honored to have with us Dr. Saurabh Arora, President of IPA DSB, Executive Director at Arbro Pharmaceuticals, and a leader in pharmaceutical research, innovation, and industry-driven solutions. His work spans drug delivery, regulatory science, and laboratory excellence. We are pleased to have you here, Dr. Saurabh. Now, I would like you to introduce to our speaker. To guide us through the insightful discussion, we are privileged to welcome our esteemed speaker, Dr. G. Sumalata. Dr. Sumalata is a highly respected academician with extensive experience in pharmaceutical education, mentoring, and guiding students toward meaningful and future-ready careers. Her strong academic background, combined with practical insights into the evolving pharmacy landscape, makes it an ideal guide for today's topic. Ma'am, we are honored to have you here, an ideal guide for today's topic. Ma'am, over to you.
Yeah, thank you, Ishika, for a nice introduction. Uh, Respected Saurabh Arora sir and all other office parents of Indian Pharmaceutical Association and distinguished members of IPA Delhi State Chapter, especially, and whomever, if there are any faculty members are attending, and yes, students, student pharmacists, and colleagues, very good evening to one and all. Really, it gives me an immense pleasure to be a part of this National Pharmacist Day webinar, which is organized by IPA Students Forum Delhi State Branch in collaboration with IPA Delhi State Chapter. At the outset, I sincerely appreciate the initiative taken by the student coordinators, especially Ishika and her team, and organizing committee in choosing such a relevant and forward-looking theme. Actually, pharmacists of tomorrow carry beyond dispensing. So really, it's a very thought-provoking theme actually. National Pharmacist Day, as you mentioned, of course, I feel that it is not merely a day of celebration. It is a day of reflection, responsibility, and deep commitment. It reminds everyone of the evolving role of pharmacists as a healthcare professional, educators, innovators, researchers, and leaders who contribute significantly to patient care and public health, especially. And this pharmacy education and career excellence. This theme, especially my dear students, pharmacy education today is no longer limited to acquiring a degree or mastering dispensing practices. This profession has expanded Far beyond the traditional boundaries, I feel pharmacists today are integral to number one, I think clinical decision making, pharmaceutical research and development, regulatory affairs and pharmacovigilance, academic and educational leaders, public health, policy making, and also entrepreneurship and healthcare innovation. As a future pharmacist, my dear student pharmacist, you must aim not just for an employment, but for excellence, leadership, and impact. So that is uh, my view as a budding pharmacist. You should think of the main vision of this IPA education division. Uh, like it's about nurturing the pharmacists who are academically strong, ethically grounded, and professionally competent and socially responsible. We see all these four qualities in the student, especially in case of education division. Our focus is on quality education, skill development, mentorship, and continuous professional development. We strongly believe that pharmacists of tomorrow must be adaptable, technologically competent, and patient centric. So, uh, can we move to the presentation, Ishika?
Ma'am, I've shared the screen.
Yeah. Uh, so moving to the next slide. So I have a control or you will control, Ishika.
I'm sorry, ma'am.
So do I have a control for changing the presentation or you will change?
Ma'am, I will change. You can just tell me when to change the slide.
Okay. Please go to the next slide.
Next.
Yeah.
Is it visible?
No, only title slide is visible. So can you please go to the next slide? Second one.
Wait a minute. Can you see that?
Yeah. Um, Before this one, actually, yeah, vision objectives. So the main objectives of the current session is I want all the student pharmacists to understand the evolving role of pharmacists, and you have to explore the diverse career options beyond dispensing, and everyone has to identify their own skills, which is required for future registered pharmacists, and inspire this uh, career planning and adaptability. So this is the thing. So how you have to improve your skills, and what are the essential skills for future pharmacists? To succeed beyond dispensing, I urge each and every student to focus on developing the few essential skills. So that is, you should have a strong foundation in pharmaceutical sciences first of all, and then you should have a good communication and interpersonal skills, and critical thinking and problem solving ability should be nurtured by the students. Digital literacy and such aptitude is also necessary. Professional ethics and lifelong learning attitude. So remember, all your degrees may open doors, but skills and values sustain your career in future. So that is the thing. So coming to the next slide. So as I mentioned, vision of our education vision is very clear. We need to prepare the students as a national leaders in pharmaceutical field by nurturing competent, ethical, and socially responsible pharmacy professionals. So for these, definitely they should be academically strong, ethically grounded, professionally competent, and socially responsible. So these things, four characters should be there. So then only our focus is mainly on quality education, especially skill development, mentorship, and continuous professional development. Next slide. So current landscape of pharmacy in India. If you see how the pharmacy practice is evolving in our India, so it has evolved significantly, transitioning from traditional roles, which is focused on only on dispensing medications, but now it is more into diverse responsibilities like clinical roles, patient care, involvement in healthcare decision making. So like so now our profession is recognized as a crucial in the healthcare system, which is contributing to both public health as well as the patient outcomes. So, as I mentioned, everyone, students must be professionally ethics and lifelong learning attitude will be there, should be there in the student. Next one. So, coming to the pharmacy workforce statistics, as of 2022, there are only approximately 1.5 million registered pharmacists in India, with a workforce comprising both community and hospital pharmacists. Now, these statistics has increased. We have seen the growth, which is reflecting the increased educational opportunity and a rising demand for pharmaceutical care. Of course, this COVID also taught a good lesson to all the public also that became a part of all the other healthcare professionals, and our role became very crucial. Next, please. So, apart from this, what are the challenges which is faced by the pharmacist? So, pharmacists in India, we have several challenges. We have the challenges from recovery because it's becoming a value for us, lack of recognition for clinical roles, and we have very limited opportunities for advancement. Apart from this one, there is disparities in education and access to the resources affect the ability of the pharmacist to fully engage in innovative within the healthcare system. So these two are the main drawbacks. So and challenges which is facing by the current pharmacist. Next time. So must practice. So we have two modes. One is traditional mode and another one modern era. Traditionally, what pharmacy practices will do is they discuss medications actively and of course they provide the patient counseling. They manage medication therapy and also monitor drug interactions and educate the patients about the medication. This is the traditional one. But in modern era, pharmacists are becoming patient-centered, developing patient-centered care, and they are becoming a critical decision maker. And this technology which is introduced is becoming a very fortunate driving roles for everyone. Next slide.
Sorry to interrupt, ma'am, but your voice is not clear at all. It's breaking in between.
Are you sure now?
Yes, ma'am.
Is it okay now?
Yeah, it's better now.
Sure.
Yeah, ma'am. Thank you.
So actually, when I am speaking, it's re-voice is coming, so that's why I have reduced the keypad volume. Now it is okay, Ishika?
Yes, ma'am, it's okay now. It's fine.
Okay. Can you please move to the next one?
Sure, ma'am.
Yeah, what are the emerging career opportunities? And for this emerging career opportunities, students must have essential skills for pharmacy students, especially for future pharmacists. So, to succeed beyond dispensing, everyone should have a strong foundation in pharmaceutical sciences. So, that is main criteria to be successful in pharmacy field, especially. So, next, so we have positions in research and development, which is also collaborating like industrial role also. So, even industrial role is also same like this research and development position. So in pharmaceutical industry, pharmacists are playing a crucial role for the innovation of new drugs and therapies especially. And the background of the pharmacist in research can contribute to clinical trials on new drug formulations and customize the regulatory decisions and making significant impacts on the health outcomes. So this is the main thing which has a pharmacist in the research and development position. Next slide. So coming to the academia. So as you all of you know, opportunities in academia is mainly to engage teaching, mentoring the student, and helping the students in making research work. And as you teachers, you also can do the research, and then you can improve your career, and also you can make the part of students also in research. So this play a vital role, especially in shaping the next generation of pharmacy professionals and advancing the field through academic contributions and scholarly work. So, especially students, you are the future ambassadors of the pharmacy profession. Be curious, be committed, and be courageous in exploring new career pathways. Always remember that pharmacists are not just medicine experts; they are healthcare leaders and change makers. So that is a thing you have to remember. And this is the role of teachers, especially. They should mold the students in such a way that they should become healthcare leaders and change makers in the society. Next slide. And clinical pharmacy and patient care. So we have a role in this field also. So especially the pivotal role of this clinical pharmacy sector is one should enhance the patient outcomes through direct patient care, medication therapy management, and we can collaborate with other healthcare practices. So the roles in this clinical pharmacy and patient care sector are you can be clinical pharmacist, you can be a specialist in pharmacotherapy, you can be a critical care pharmacist, and you can choose various departments like oncology, cardiology, and infectious diseases. And you can be a collaborative practice practitioner with the physicians also. In such a way, also you can explore in case of clinical pharmacy and patient care department. Next slide, please. Coming to pharmaceutical industry roles, as I mentioned you earlier, in case of research and development, you can be a part and you can be a pharmaceutical marketing strategy person, and you can be in a regulatory compliance important, and you can play a role in quality assurance of the industry, and you can be a strategist for market access also. So these are the roles which one pharmacist should have in case of industry. Next slide. So coming to the regulatory oversight and quality control. So here you have two concepts. If you want to ensure the compliance and safety of the regulated system, you can be a part of that one. So this plays a crucial role in ensuring that every uh, every pharmaceutical product should comply the laws of regulations of the CDSCO especially. So the pharmacists are responsible for preparing and submitting the necessary documents through the regulatory agencies, and one should ensure that the products in the market are safe and effective for consumer use, especially related to patient safety and care. This role requires a deep understanding of the especially regulatory policies and regulatory environment, and one should have the ability to navigate the complex legal requirements. So that is the main role in case of ensuring the compliance and safety in case of regulatory affairs and quality control. Next slide. And in next slide, please. Sister. So in this one again we have another role, testing and assurance of quality. So testing and assurance of quality comes one should uh, be a specialist or essential in pharmaceutical industry to ensure that product meets predetermined safety and efficacy standards. So one should conduct a rigorous testing and quality assurance check. They have to monitor all stages of the product process. Their work helps to prevent defects and ensures that the final product is reliable for patient use and safety, especially. This role demands meticulous attention to detail and a strong background in laboratory practice. So this role is very crucial because there is a check in each and everything. So that each and every stage of the product development, there is a check. So that is a crucial. It is a crucial role by a pharmacist in case of testing and assurance of quality. Next slide, please. So coming to the another role, we can be a part of pharmacovigilance and safety. So this is also like product safety. So this plays a vital role for ensuring the medications are safe for public use, like a quality check, mainly because the continuous monitoring of drug safety even after they have approved for use. So post-marketing surveillance kind of thing, and helping to identify any adverse effects or long-term impact that may not have been evident during clinical trials. So we can say this as a post-marketing surveillance, which helps the patients to be safe and very safe for public use. Next slide, please. And case of regulatory complaints in India, so we have certain guidelines set by the Central Drug Standard Control Organization, CDSO. So these regulatory requirements of pharmacovigilance include compliance with these kind of guidelines especially. So every pharmacist must be familiar with these guidelines to contribute effectively to drug safety monitoring efforts, especially. So need not to be a regulatory affairs quality control person, but every pharmacist must have an understanding of this CDS guideline. Next, and can be a part of public health and policy advocacy. So some pharmacists are taking active roles in such kind of healthcare policy and system level decision making. These pharmacists are essentially contributing to drug formulary design, public health planning, and hospital pharmacy design and ethical review boards. So their unique medication expertise offers critical insight in the regulatory and healthcare design discussions. So this is helping the common public to have a more knowledge about all the drugs and their usage and their ADR and their drug interactions. Next slide. So one can be an entrepreneur also, and they can be a part of innovative practice models also. So the pharmacists are leading new business models in telepharmacy, especially in recent days, wellness clinics and digital therapeutics. So these are the three main roles nowadays. We have innovative practice models. This demonstrates their adaptability and the professional entrepreneurial potential. One, both are interlinked. Entrepreneurship with a innovative practice models is like a big boom nowadays. Next slide. So our team can be a sales, marketing, and market success also. So we can be as a sales manager in pharmaceuticals, and we can manage the product And we can do a research on the market also, pharmaceutical market and sales, and health economics and outcomes research, and strategic planning can be given to the all the pharmaceutical industries for effective sales and marketing. Next slide. So one more opportunity for all the pharmacists is about health informatics and data analytics. So these digital health records and AI tools became standard. Pharmacies are getting involved in this data-driven care. Now AI is playing a major role in case of this health informatics and data analytics, so that we can reduce mean person manpower and also time also we can conserve. Interpreting patient health trends and using clinical patient support systems and improving the workflow efficiency and medication safety through data insights. So this like is a hybrid of clinical knowledge and technology influence. So it is giving lot of effective results in case of this health informatics and data analytics. Next one, please. So coming to what are the various global opportunities for the pharmacist available. So we can be a licensor for international thing. Global pharma companies are waiting for the recruitment, and there are so many research collaborations internationally. You can collaborate with all other universities which are uh, across the globe. They are also very much interested in the Indian research, and we can have remote and hybrid roles with the international collaboration, and we can have cross-border healthcare also. So there are so many global opportunities for the pharmacists in present scenario. Next slide. Pharmacy education and skill development. So current educational pathways are we have D-Pharm, B-Pharm, M-Pharm and PharmD programs. They are mainly emphasizing the need for updated curriculum and continuous professional development is needed. We have to meet the significance of ongoing training and certificates in specialized areas. Skill for the future roles is identify essential skills such as clinical assessment, communication, and data analysis, which are necessary for emerging pharmacy careers. Especially as an academician, the role of academicians is mentoring the students and mentoring the student engagement. So this plays a pivotal role in shaping professional journeys. I personally encourage students to actively engage with professional bodies like IPA and participate in conferences, workshops, and students' forums and seek guidance from the teachers and senior professionals. These platforms, such as the Typing Students Forum, are excellent opportunities to build leadership qualities, networking skills, and professional confidence at early stage. So, my dear students, you are the future ambassadors of the pharmacy profession. You should be very curious, and you should be very committed, and you should be very courageous in exploring new career pathways. Next slide. So, technology and digital health in pharmacy. So, advancement in digital health are reshaping pharmacy practice and enhancing patient health at the time. So, 70% rise in digital health record system adopted by pharmacists, and in 50% increase in patients using pharmacy apps for medication reminders, and 40% people are pharmacists are reporting and enhanced patient interactions due to telehealth. 30% growth of telepharmacy usage in India is driven by the need for accessible healthcare. So for the least 25% efficiency improvement in medication management through AI implementation. Now coming to AI implementation, how it is helping to the pharmacy profession. Next slide. So why AI is increases opportunities for the pharmacist because it is expanding the role. How it is expanding means it is becoming smarter clinical decisions and personalized therapy, faster drug development. It is reducing the time, manpower, and improving the medication safety. And we have a stronger public health impact. So, why what AI cannot be replaced? So, AI cannot replace the ethical reasoning, empathy, clinical accountability, and team-based collaboration. So that's why AI with collaboration, with team-based collaboration, and all these persons. So there is a good ethical AI stewardship can be achieved. Pharmacists ensure patient safety, data privacy, bias control, transparency, and regulatory compliance. All these things plays a major role, and we can improve the medication safety, and we can become a stronger impact in the public health, especially. Next, so what are the skills should be there for the pharmacist of tomorrow? So as I told you, clinical and professional foundations are necessary. AI and digital literacy are necessary, data and analytical thinking, digital health, and technology skills. So these are the skills. Apart from this one, everyone should be strong, have a strong foundation in pharmaceutical sciences. Everyone should be strong in communication and interpersonal skills. Critical thinking and problem solving ability should be there. Digital literacy and research aptitude should be there. Professional ethics and lifelong learning attitude must be there. Then only you can sustain in the your career. Next slide. So, as I mentioned, ethics, law, and governance, research and innovation mindset, leadership and professional skills. So, these combination decision making, teamwork, change management, plus advocacy leads to a strong leader in case of pharmacy profession. Next slide. In a, how to prepare while studying. So this is the main thing which should be learned by the students. Uh, while studying, you can do few internships and certificate courses which are available online. So you can do online internships and online certifications. If you have the facilities in your respective places, you can do offline also. And you be a part in research projects and research collaborations so that you can learn so much of knowledge about the research and choose skill-based courses only, not for the theoretical purpose. So you should choose the skill-based courses. And networking and mentorship will give a lot of information and tips. Attend conferences and workshops which will teach you at least definitely there will be a takeaway messages from these conferences and workshops. Join in pharmaceutical organizations and NGOs and be like a better person and you will become a better pharmacist. So everyone has to everyone must be joining the pharmacy research organizations and NGOs also. So that is the thing everyone must concentrate. All the pharmacists, especially budding pharmacists, should think and attend the conferences and all the things you have to. Then next slide, please. And future outlook of the pharmacy profession. So whatever the things like policy making, research and community outreach, so they emerge as areas where pharmacists are making meaningful contributions. Pharmacogenomics and health informatics, they also play a crucial role as a pharmacist in interpreting data and personalized care. And pharmacists are taking new responsibilities in public health, vaccinations, chronic disease management, and mental health support. Nowadays, pharmacists are becoming healthcare counselors also. They are doing lot of counseling. All these roles require critical thinking, ethical discriminate, and collaborative leadership quality that machines are never equipped to develop. So everyone must think that machines cannot do all these kinds of things. So, as a conclusion, I can say I once again congratulate the organizing team for selecting an impactful theme and organizing this meaningful academic event. I am confident that today's interaction will inspire students to think beyond conventional roles and prepare themselves for a dynamic and fulfilling professional future. I wish the webinar a great success and really I extend my best wishes to all the participants. Thank you and I look forward to an enriching interaction during the session. Jai IPA, Jai Pharmacy. Over to Ishika. Thank you.
Yes. Thank you so. Am I audible to you now?
Yeah,
Thank you so much, ma'am, for an enlightening and inspiring session. Your insights have truly helped us understand how the pharmacy profession is expanding for roles beyond conventional boundaries. We will now proceed to the Q&A session. Some questions have been already received from the participants. So now participants are also welcome to share their questions in the chat box. And for the first question, ma'am, the question is, how is pharmacy in India shifting from dispensing to patient-centered care?
pharmacy in India is shifting from dispensing to this one, especially earlier days, as I mentioned, it is only restricted to dispensing, but now it is evolving to so many roles like what you can tell, as I mentioned, globally we have so many possibilities. So we can have so many roles. We can be a public health vaccination anywhere, or we can be a part of chronic disease management, and we can be a part of mental health supporter, or we can choose the fields like pharmacogenomics and health informatics. As I mentioned, we have so many roles in industry, and even sales, marketing, and market access is also very much playing a pivotal role. And we can be a part of health informatics and data analytics also. So there is a lot of change and shift in this traditional to modern. Ishika, is it okay?
Did you hear me?
Yeah, am I audible?
The question was, why are clinical roles still under-recognized despite a large pharmacist workforce?
Can I repeat the question? Why?
The question is, why are clinical roles still undermined in the society despite a large pharmacist workforce?
Yeah, obviously, I told you the challenges. Clinical role is always now it is in one. The main challenges are regulatory barriers, and we have few challenges like uh,
Yes,
what you call uh, roles, barriers, and regulatory things, and there is no proper recognition for clinical roles, and we have limited opportunities in the advancement. Of course, in education system also, the curriculum is not properly meeting the role of assist in the practice. So this also becoming this one.
yes. And the other question is, which pharmacy career path currently offers the strongest long-term growth and why?
Which
Pharmacy career
pharmacy
currently offers the strongest long-term growth and why?
oh, it's a wide question actually. Uh, long term and strong means AI know it is playing a crucial role. Uh, we can
Yes. Ma'am, shall I move to the other question?
no one. There is a just that's all. So clinical, I mean, we can say that AI first thing, or we can be a part of pharmaceutical research and development, or clinical research and clinical trials. So in every sector there is a development, and earlier it is mainly focused on medical writing and scientific communication. That was a very huge growth, but now it is shifted to so many things. So that is like we have this growth in each and everything. So if you are an entrepreneur and if you develop own consultancy, you have so many, you can see so much of growth, and that is consistent and persistent. You can sustainable long term can be achieved in case of entrepreneurship and consultancy. So it depends
Yes.
on the profession you choose. If you are interested in entrepreneurship, you can succeed. Or academia, research, leadership can also be done. And if you are interested in digital pharmacy and health informatics, that also will give. Mean, I always feel that it depends on the efficiency of the student and how student is strong in case of basic knowledge and basic skills. I mean, we can't tell that. So this is the main role, or this is the main caring which student can uh, shine. It all depends on the strong foundation of the student in pharmaceutical sciences and their communication and interpersonal skills. So we
Yes.
have people who are succeeded in so many fields. Like we have people in clinical pharmacy, patient care sector. We have people in pharmaceutical research and development sector, clinical research and clinical trial sector, regulatory affairs sector, even pharmacovigilance also. So that's why uh, it all depends on the student potential. We can't judge or we can't give to a conclusion that this is the best one.
Yes. And ma'am, for the last question, what mindset shift is most important for a pharmacist aiming for leadership role?
Mindset means he should have a teamwork ability, uh,
Yes.
strong leadership role builds from I first. I mean, first you should work, you should have a knowledge, and a strong leader obviously is shaped less by position and more by mindset. I think you got it. So leader
Yes.
should be shaped less by position. So he should not be fond of the position. More he should be strong in the mindset, especially in healthcare and pharmacy education. Leadership begins from how one thinks, learns, and serves. So these following uh, usually mindset should be vision driven mindset should be there, and learning oriented mindset should be there, and service first mindset should be there, ethical and value based mindset should be there, and accountability mindset, growth mindset, patient centric mindset, courage decision making mindset. There are so many mentorship mindset. So this is a mindset you practice daily through discipline, empathy, learning, and service. So before you become a leader of others, become a leader of yourself. That's all I can say.
Thank you so much, ma'am. And now to formally conclude this session, on the behalf of Indian Pharmaceutical Association, Delhi State Branch, and in the Indian Pharmaceutical Association Students Forum, Delhi State Chapter, I extend my sincere gratitude to our esteemed speaker, Dr. G. Simulata, for sharing a valuable knowledge and guidance with us today. I would also like to thank all the participants for their active involvement, which made this session engaging and meaningful. Special appreciation goes to the organizing media and technical teams for the dedication and efforts in making this webinar success. Thank you so much, everyone, for joining us for Know Your Profession, Pharmacist of Tomorrow, Careers Beyond Dispensing. I now request the immediate, and I now thank you so much, ma'am, for again joining us and giving us the inspiration and valuable knowledge. Thank you so much, ma'am.
Thank you, Ishika. You have done a great job. Keep it
Thank
up.
you, ma'am.
And in your leadership, even much more things has to be done.
Thank you, ma'am. Thank you, everyone.